After a hike in the mountains on his day off, registered nurse Alan Collison and wife May stopped for pizza. That's when May noticed something wrong. Alan's face looked different, and he almost fell when he tried to stand. Knowing the signs of stroke, May screamed, "Call 911." That's when Alan found himself back at work as a patient and not the trauma nurse he's known for at Community Regional Medical Center's Table Mountain Rancheria Trauma Center.
And I was thrilled to see the people I work with. I wasn't great with the amount of concern on their faces. And they had everything ready to go and waiting just like it's supposed to be, and they called a stroke alert.
As a primary stroke center, Community Regional offers the highest level of care in the valley, and lucky for Alan, has the only interventional neurologist and neurosurgeon, Doctors Robert Ryan and Amr Khan, uniquely and expertly trained to save a stroke victim's life.
The longer the brain goes without oxygen and nutrients, the more of the brain dies. So when the brain dies, that's permanent, and we can't recover from that. Often when the artery is blocked for a short period of time, the brain is able to go into a type of hibernation. So the longer those cells are in that hibernation mode, the less of them are going to survive. The faster we can get the blood flow back, the more of the brain we can save, and the more of a recovery the patient's going to see. Blocked with good blood flow all the way up that artery.
Medication didn't dissolve Alan's clot, so Dr. Ryan had to retrieve the clot from inside the artery, which was life-saving for Alan.
And Dr. Ryan, who worked a miracle and could work it for anyone else anywhere around here, he sucked a giant clot out of my middle cerebral artery, which was completely occluded with clot. I was fortunate that I had a little bit of medical knowledge, and I knew that there was only one place in town that could do that for me, and it was the facility I'm lucky enough to work at.
Patients like Alan benefit from Community Regional's hybrid operating room, which provides surgical advantages for those needing life-saving surgery, the only one of its kind in the region with hybrid biplane technology and interventional neurology and neurosurgery.
Only a few large centers across the country are doing this, and in addition, the new technology we've brought in with the Siemens interventional machine that we have it's the first one in California with the new generation of detector panels and imaging software. So the type of treatments we're able to offer because of that have really been expanded. Yeah, we'll have this body awareness.
And that's why Alan had the best chance at recovery, because of the Level 1 Trauma Center, top treatments, excellent rehab, and the only specialist in the valley able to give this higher level of care.
And I had a pretty good outcome. They seem very optimistic, and the people here on Leon S. Peters are awesome, and they're teaching me to walk again.
Just 4 days after surgery, physical therapist Norman Hubbard began Alan's rehab at Community Regional's Leon S. Peters Rehab Center.
His progress is definitely in the upper threshold of stroke recovery. You know, especially some of the key components that we like to see, and I really think that his overall recovery is going to be on a higher level. He's going to function on a higher level because he has such early intervention.
Alan's wife recognized stroke symptoms and got Alan to Community Regional's Trauma Center fast. Here's what to look for. Face. Look in the mirror to see if your smile is uneven. Arms. Try to raise your arms. Speech. Are your words slurred? Unable to repeat a phrase? Time. Time is critical. Get to the hospital immediately.
Speed is really of the essence. Getting the arteries open and getting blood flow back to the brain is a major factor in improving outcomes.
It's the work of this facility, and I really appreciate the opportunity to let people know what great things happen here, and that if I'd gone anywhere else, half my brain would be dead now. Not all hospitals are created equal, and the general public thinks a hospital is a hospital, and that's very untrue. There's nothing else like this from Sacramento or San Francisco all the way to LA. This is it. And we can make a difference in your outcome, definitely. A big difference. And whether or not you're going to be disabled could change right here in this building. I'm just so proud to work here.
Norman says he has great hope for Alan's recovery. He's spent 35 years as a nurse saving those most critically ill or injured in our valley.
He's been a big part of this hospital for a long time. He's very compassionate about his patients and what he does. And then they save lives downstairs. And when they do that, you know, we try and help them get functional enough to get home, be safe with their family. And that's our job.
We're making progress. I'm looking forward to going back to work part-time at least. And they're teaching me to walk again. And like I like to say, tough times don't last, tough people do. And that's what I'm trying to live by.